हेलो दोस्तों, आप सबको मेरा प्रणाम। Am I audible and visible? Yes, Srinivas. Am I audible? Yes, Srinivas. Good evening. So, good evening, all. Yes, Menaka Datta. Srinivas. How is your preparation going on? Am I audible? Foodie brother. Okay, so आज का डिस्कशन का टॉपिक है टॉक्सिकोलॉजी. So basically, heavy metal poison. It's a very important topic. लॉन्ग ऐसे भी आ सकता है, शॉर्ट ऐसे भी आ सकता है, एंड काफी सारे इमेज बेस्ड क्वेश्चन भी है इसमें. ठीक है, सो वी आर गोइंग टू डिस्कस द लास्ट सेशन ऑफ Farre. So we completed the 7th session. So this is basically 8th session of Farre. So in this session, so we are going to discuss about a few heavy metal poison and few important 3 marks question and 5 marks question. Okay. Sarabjit, fine. All well. So this is one interesting question for you in the beginning. A man dies after weeks of diarrhea. So basically, husband and wife. The man dies after weeks of diarrhea and weakness. After his death, his hair and nails were preserved. The wife was calm until her browsing history revealed how to poison without smell. How to poison without smell. मतलब तो बिना गंध के किसी को जहर कैसे दे. So this was her browsing history. And can you just tell me what was the poison used by the wife in this case to kill husband? Okay. So what is this? Sanjana, Lokesh and others. What is probably this condition? And what we can see here, diarrhea, rice watery stool. The weakness, diarrhea, rice watery stool. One very common suspected poison is arsenic poison. Okay. So this is basically arsenic poison. So basically arsenic trioxide. So arsenic can be a 5 marks question, can be a 3 marks question, and very commonly asked MCQ, very commonly asked in your Viva as well. So बहुत बार पूछा गया है in exam में. ठीक है? Okay. So let's start with the arsenic. So this is one commonly asked question. Explain in detail about arsenic poisoning. So what are the toxic principles of arsenic? What is the fatal dosage? So what are the clinical features of acute and chronic poisoning? What are the common tests done? and also about the treatment. So you need to write about, so what are the preparations? What is the fatal dosage? Then clinical features. So acute and chronic. Then about the investigation. The lastly, the treatment. So all these points must be there in the answer sheet to get good mark. Okay? Yes. Okay. So Manjunatha Datta, so you are right. So this is basically arsenic poison, and the compound that is visible here is arsenic trioxide. So this is ideal homicidal. So it's ideal homicidal. So what are the features of ideal homicidal agent? It's a colorless compound, tasteless compound, odorless compound. It mimics like a natural disease, that is cholera. So one of the ideal homicidal is arsenic. Another example, that is basically thallium. Okay, so it is also known as king of all poison. King of all poisons. So basically arsenic trioxide. Arsenic trioxide. Good. Yes, so again it is cheap. The action is late. You are right, Smaranya. Good, colorless, odorless. That's okay. Now, can anyone tell me who was the famous king? The Kaunta, who was that king killed due to this arsenic poison? Can you name one famous king died due to arsenic poison? Let's see. Sanjana, location, others. Who was that famous king? Died due to arsenic. Yes, very good, Manjunatha. Good. So he is a smart king. You can see a smart king died due to arsenic poison. His name is Napoleon Bonaparte. So his servant, he was mixing arsenic with his food and drink every day. So because he was having a sexual affair with the wife of the servant, some personal motive was there. That's why he used to mix small amount, very small amount, maybe 10 milligram and 20 milligram every day for about many months. So later he presented with the hair loss, alopecia, Aldrich Maestlin, and he died due to stomach carcinoma as a result of arsenic poison. After his death, he died at the age of 35-40. So his hair and nails were preserved. Then later, after 50 years, 100 years, they examined his hair and nails. They came to know very high levels of arsenic in his nail and the hair. Okay, so Napoleon Bonaparte. So just try to remember, king of all poison, arsenic. The king who was killed, Napoleon Bonaparte. Okay, Napoleon Bonaparte. Good. So mnemonic is also same, Napoleon Bonaparte. Bonaparte. Mnemonic is Napoleon Bonaparte or Bonaparte RRR. I just prepared one mnemonic to simplify arsenic poison. The mnemonic is Bonaparte RRR. The recent movie RRR. So yes, all of you just write in the chat box Bonaparte RRR. Just write so that we'll have discussion about this mnemonic. Very interesting. So let's start with the Bonaparte. So what is B? The B is black foot disease. Very important. Recently asked in INI-CET. The black foot disease is because of vasculitis. So leading to gangrene. So B for black foot disease. Because of the vasculitis, there can be gangrene and there is a blackish discoloration of the limb. So B for black foot disease. O is there, no? O means oxide. So O is oxide. Arsenic trioxide. So that is also known as Sankhya, Somalkar, white arsenic. Important. Then what is the fatal dosage? 120 to 200 milligram. MCQ. What is the fatal dosage in terms of body weight? 2 mg per kg body weight. And in arsenic poison, the smell is garlic smell. So all these points that do come along with the O, that is oxide. Okay. Then comes is your N. N means neoplasia. So arsenic is a carcinogenic. It causes many cancers. It causes skin cancer, bladder cancer, and also lung cancer. The most common cancer is skin cancer. And in case of arsenic poison, we preserve nails and hair. So N for neoplasia. A for alopecia, anemia, Addison's leg disease. It also found in ashes, basically in the bones. It is also aphrodisiac. It is also used in abortion. It also induces apoptosis. So there are many A's are there with arsenic. A, all this. So very commonly asked question, 5 marks question, 3 marks question. You can remember, you can write all these points in the exam. Then P for peripheral neuropathy. So basically it is distal neuropathy, mixed neuropathy. So it causes motor neuropathy as well as sensory neuropathy, and it commonly affects the distal nerve, distal neuropathy, commonly asked in the exam. Yes, Sutapa Samantha, aphrodisiac means it is a substance which increases sexual desire. Okay, so sexual desire, so that is aphrodisiac. Then A for Aldrich Meesline. So I'll repeat again: black foot disease, oxide, neoplasia, alopecia, peripheral neuropathy, then Aldrich Meesline. So now let's see some image-based question. Now look at this and try to answer. So what are these images in relation with arsenic poison? So say example, this is A, this is B, this is C, D and E. So try yourself. Try. Maneka Datta, Srinivas. So this is clinical condition caused by arsenic poison. We discussed already, black foot disease. Commonly asked image-based question. Okay. Yes. And B, arsenic trioxide. You can see the colorless compound there. Then image, very important image. Look at this, the nails showing white color line, Aldrich Meesline. Okay, Aldrich Meesline. And remember, Aldrich Meesline can be seen in thallium also. Thallium. Thallium. Okay. Yes. Now look at this compound. So this is arsenic compound. Normally arsenic trioxide is white in color, colorless. But here it is mixed with the copper. As you know, copper is green color. So this is copper acetoarsenate, known as Scheele's green. Scheele's green. So question can be asked, what are the preparations of arsenic? Scheele's green, copper acetoarsenate, which is green in color, which is used as a coloring agent. Then Paris green. So this is Paris green. So can anyone tell me what is the use of Paris green? What is the use of Paris green, which is basically an arsenic compound? So Paris green basically it is larvicidal, okay, stomach poison. It is the stomach poison. It is used in mosquito control as an insecticide. Okay, good. Larvicide and all, that's great. So this is about the 5 important images. So arsenic, is it clear? Maranehati? All the 5 images very commonly asked in your INI-CET, NEET PG also. Menaka Datta, Sutapa, Srinivas, Sanjana, Lokesh. Yeah. Sutapa, Samantha. Yes, J. So reply me. Yes. Fine. Then comes his, Bonaparte RRR. So R for rigor mortis lasts longer. So as you know, rigor mortis that starts within 1 to 2 hours. So in case of arsenic poison, it lasts longer. So it can be more than 12 hours. So it can be 14 hours, 18 hours like that. Then it also retards putrefaction. Again, very important MCQ. The putrefaction inhibited by arsenic poison. So normally putrefaction starts immediately. So all the putrefaction changes, they are very commonly seen after 24 hours, 48 hours. But in arsenic poison, so it is inhibited for some time. So it is prolonged, we can say. Okay? Yes. Then it is a teratogen. Arsenic intake, arsenic toxicity in pregnancy can lead to some congenital anomalies. It can lead to criminal abortion or abortion basically. Then E for enteritis, it looks like cholera. It causes endocardial hemorrhages, especially over the heart. Endocardial hemorrhages, non-specific finding. Then one more R is there, no, raindrop pigmentation, very, very important. Raindrop pigmentation is a very important finding commonly seen in arsenic poison. R for rash also. So there can be rash. Red velvety stomach in case of acute arsenic poison. Rinse test is a test for arsenic poison. So all these are important one-liners related to arsenic. Okay. Good. Chalo. Now comes is the investigations. So what are investigations? And treatment. Treatment. Okay. Good. So investigation. So by using certain test known as Marsh test, gut sheet test, neutron activation analysis, NA. So Marsh, gut sheet and all, rinse and all, they're outdated. Nowadays we are using neutron activation analysis. In case of death, we are going to measure the levels of arsenic in hair and the nail. Okay, so treatment is basically British anti-Lewisite. So what is the drug of choice? Drug of choice is BAL, that is British anti-Lewisite. So commonly asked in exam, it's a chelating agent. Okay, good. And that's great. Now let's see some more images relation with arsenic commonly asked. So can anyone tell me what are these 5 images in relation with arsenic poison? Look at this hand. Okay, in hand there is a finding. What is that? In acute poisoning in the stomach there is a finding. And my favorite garlic is here. And look at the hand here. There is a redness. What is this known as? And what is this compound known as? Can anyone answer? Yes, good. Keep answering, guys. So this is basically raindrop pigmentation. Okay, can be image based question. And in the stomach here, red color appearance, red velvety stomach. And in case of arsenic, the smell of the dead body opening the cavity, garlic smell. Garlic smell also seen in phosphorus poison. And the finding here is erythromelalgia. Erythromelalgia. And here what we can see here, the very important compound which is a very important chelating agent. So this is basically BAL, British anti-lewisite. So in British anti-lewisite, there are 3 carbon atoms are there and there are sulfhydryl radicals. So this sulfhydryl radical combines with the arsenic, it makes the water soluble compound, it gets treated in the urine. Okay, good. So this is what you need to remember, very commonly asked in the exam. And one more very commonly asked Viva question, what are the contraindications for BAL? Can anyone tell me? What are the contraindications? Srinivas, Maneka Datta, SJ, Sanjana Lokesh, Sanjana. What are the contraindications of very famous chelating agent, that is BAL? So contraindications are, so one is cadmium poison, iron poison, organic mercury, and peanut allergy. So 5 important contraindications. So this is about arsenic. So again the question can be asked, what are differences between arsenic and cholera? This is very simple. You can just go through these notes after the class. Okay, so differences. Now try this image based question. Look at this. So during autopsy examination, the total stomach is inflamed, so hemorrhagic. What is this condition known as? Try. Yes. Good. Yes, very good. So this is known as red velvety stomach. Good. Acute arsenic poison. Sanjana Lokesh. Great. Now, in case of arsenic poison, I said there is some finding over the heart. So what is the finding here? So look at this. In case of acute arsenic poison, so I said there are some hemorrhages over the heart. So we call it as Sheehan's hemorrhages, endocardial hemorrhages. So this we can make out here, endocardial hemorrhages. So this is basically heart. Fine. So next important question. So commonly asked in the exam, Datura poison. So this is Datura fruit, thorn apple. So all is are Datura seeds. Okay. So commonly asked question, Datura poisoning. So is it clear, guys? Arsenic. So arsenic is known as king of all poison. The mnemonic is Bonaparte RRR. And the drug of choice is BAL. And investigation of choice is NAA. So we discussed about raindrop pigmentation, Aldrich means line, and also about other features as well. Is it clear now? Sanjana, Srinivas and all? Okay, that's great. So next heading, very commonly asked, Datura poison. So Datura is a deliriant. Deliriant. Delirium means confusion. So it causes confusion. So Datura consists of, so what is the active principle? Hyoscine, hyoscyamine, and atropine. So there are three important active principles: hyoscine, hyoscyamine, and traces of atropine. Fatal dosage 100 seeds. Fatal period 24 hours. 24 hours. Okay. Then look at the fruit. So this is Datura fruit. It has spiny projections. That's why it is known as thorn apple. Thorn apple. And look at the Datura seeds. So they are kidney shaped. Kidney shaped. And also you can make out here. So they are brown in color, brown or black in color. They are double edged. So capsicum seeds are basically single edged. Datura seeds are double edged. Okay, so this is again very commonly asked. Good. Okay, then clinical manifestations. So clinical manifestations, so 9D manifestation. Commonly asked question, Viva question, 9D. So what are 9D? So 9D means D for dry hot skin, dilated pupil, dilated vessel, delirium, dermatitis, dysphagia, diplopia, delusions. So 9D manifestation. Sometimes there can be death also, dryness also, okay, dry hot skin. And other mnemonic is dry as a bone, hot as a hair, red as a beet. Okay. And Datura fruit is also known as Jimson weed, can be a question. Angel trumpet, thorn apple, devil trumpet, loco weed. All is other names of Datura poisoning. Datura. Okay. Yes, both are same. Sutapa Samantha. So both are same. The clinical features and both are same basically. Next comes is treatment and medico-legal importance. Treatment. Okay. So it can be long essay. So bar aata exam mein. What is the treatment? Can anyone tell me? Datura poison presents with the 90 manifestations. So there can be delusions, there can be all these features, delirium, dysphagia, difficulty in talking and all, dysarthria and all. What is the treatment? So treatment is gastric lavas, then you can give activated charcoal, then the drug of choice is physostigmine. physostigmine. So remember, physostigmine has serious side effects, especially cardiac manifestations. You should be very careful while giving physostigmine. Okay. Then the MLI, so Datura can be road poison. So point number 1, road poison. So Datura also used in like sexual assault. It is also used in kidnapping. Okay, kidnapping and all. So this is about basically Datura poisoning. So I hope you understood this. Srinivas, Sanjana, Lokesh. Yes, so it is used in sexual assault, theft, railroad poison. Good. So robbery, yes, you are right. So it is also used in robbery. So it can be mixed with the roti curry, can be given to travelers in train and buses. So it leads to confused state. When person is confused, so there are chances of robbery, there are chances of kidnapping as well. So this is basically Datura poisoning. So it is also known as Jimson weed, devil's trumpet. Okay, okay guys, is it clear? Datura poisoning? Say yes or no? So try to remember, Datura fruit always occur singly. Castor seeds occur in clusters. Datura seeds are kidney shaped. Capsicum seeds are round, single edged, yellow in color. Okay, good. Yes, good, good Menaka Datta, that's great. So second important question. Now let's see third important question. And also this is taken from K.S. and Reddy. So remember, Datura seed, Datura seeds are there now. So embryo is curved like outwards. So what you can see here, embryo, which is curved outwards. But in case of capsicum seed, embryo curved inwards like a figure of 6. This is very important INI-CET question and Viva question. So capsicum like a 6. Okay. So keep writing, guys. Capsicum is equal to figure of 6. If you write this point, you will get distinction in exam. 4 out of 5, 9 out of 10. Okay. Capsicum is equal to 6. Good, good, good. Chalo. So the next important topic. So that is basically known as Nux vomica. So this is Nux vomica fruit. Nux vomica seeds are there. You can make out here. Commonly asked 3 marks question, 5 marks question. बार बार पूछते हैं लोग एग्जाम में, ठीक है. शॉर्ट नोट भी आ सकता है और शॉर्ट एसे भी आ सकता है और काफी सारे इमेज बेस्ड क्वेश्चंस भी है इसमें, ठीक है. सो चलो, नाउ लेट डिस्कस अबाउट नक्स वोमिका. सो नक्स वोमिका इज अ स्पाइनल पॉइजन. That means it acts on the spinal cord. It inhibits glycine. So it inhibits glycine. So it causes stimulation of the system. So it increases glutamate action. Glutamate action. So when there is a increased glutamate, so there can be convulsions. As you know, convulsions hoga like this convulsion, right? So let's see what are active principles. So what are active principle? Can anyone tell me? क्या होगा active principles? And what is the fatal dosage? What is the fatal period? And what are the clinical features? And what is the treatment? And MLI. And MLI. So this is how you need to write in the exam. Come on guys, one by one. So Kuchila seeds, says Sanjana, you are right, it is known as Kuchila seeds. Good. So active principle, remember mnemonic BSNL. BSNL. B for brucin, S for strychnine, L for loganin, and N for Naxomica. So all of you write in the chat box. Naxomica is equal to BSNL. BSNL, you know, Airtel, BSNL, Vodafone, Vodafone and all. So idea, get an idea. So just get an idea. So that is BSNL. Okay, guys, BSNL. Yes, Tala Jafar. Yes, I am from South India. I completed my MD from MMC New Delhi. So that is in Delhi. Okay. Yes. So keep writing. Tala Jafar, Srinivas. आप सबको लिखना पड़ेगा. लिखो. बार बार लिखो. So one time writing is equal to 10 time reading. Okay. Hello. Keep writing, guys. So you can keep me awake. You can keep yourself awake in the forensic class. So yes, J, Sanjana, Srinivas लिखो. BSNL. BSNL लिखो. सबसे पहले लिखो BSNL. Okay. Fatal dosage, 1 seed. है ना? Taking 1 seed can lead to death. 1 seed can lead to death. Datura poison, 100 seeds. Castor, 10 seeds. So very commonly as Viva question. 1, 10, 100. I'll write here. 1, 10 and 100. 1 मतलब क्या है? 1 मतलब strychnine poison है. 1 is strychnine. 10 मतलब castor seeds. 100 मतलब datura. Datura. So try to memorize this. 1, 10, 100. Okay, guys. I hope you are enjoying the class. Okay. So keep writing this point also. 1, 10, 100 in the chat box. The fatal period is around 12 hours. 6 to 12 hours. So usually gastric emptying around 3 hours. It takes around 6 to 12 hours basically. Up to 24 hours. Clinical feature resemble like tetanus. Okay. So there will be convulsions. There will be episotonia, pleurostomatosis, devil's smile. There can be convulsions, respiratory paralysis and death. So basically resemble like tetanus. So there can be salivation, nausea, vomiting. So other clinical features as well. It's a toxin. It leads to various signs and symptoms. So tetanus. So treatment is barbiturate. Barbiturate. So what is the medical legal importance? So it can lead to accidental poison. Accidental poison, especially in children's. So 1 seed can go inside the stomach, can lead to death. Sometimes it can be used in homicide. So in the form of tablets, capsules, in the form of vitamin B capsules. So vitamin B capsules, inside that they can keep strychnine powder and they can give it to you. So yes, that's why I don't take tablet from unknown people. Then accidental, homicidal, rarely suicidal. And one more important thing is, so the powder of strychnine is white in color. It looks brown in color, brown white in color. It is mixed with the heroin. So try to understand this. So it mixed with the heroin. So when it is mixed with the heroin, so it can lead to sudden death after taking the heroin along with the strychnine. So all these are important medical legal aspects of So Tala Zafar, so great, thank you. Good. Hope you understood this. Guys, is it okay? Nux vomica, have you understood? So whenever question asks nux vomica, sir, spinal poison. What is the mechanism of action? So it inhibits glycine. Where is glycine present? In the spinal cord, postsynaptic region. So what it causes? Increased activity of glutamate. When glutamate is increased, what happens? Convulsions hoga. So what are the active principle? BSNL, brucin, loganin and all. Fetal period, 24 hours, 12 hours, 1 seed, tetanus, then treatment, barbiturate, short-acting barbiturate, gastric lavas and all you can do. Then MLI also you can write. Okay guys, is it understood? Yes, good. Chalo, that's okay. Now your turn to answer this question. Look at this now. So here a patient suffering from some accidental nux vomica poisoning. So now look at the patient here. Patient somewhat, you know, is crying like this, like this, like this, like this. What is this known as? So this is known as devil smile. Devil smile. So who is the devil in the body? Strychnine, nux vomica is the devil, bad boy. Okay, bad boy. Then it is also known as Rhizus sardonicus. So it can be seen in tetanus. It also can be in nux vomica poisoning. Okay, good. Devil's face. Good. Lockjaw also. We can see also lockjaw. Good. So this is very important image-based question in entrance exam. Okay, that's okay. Now look at this. Look at this image. Like this. I know what is this known as? Like this. So in case of tetanus and strychnine poison, so patient appears like this. So extended position. So hyperextension we call it as. So there can be flexion and extension. As you know, extensor are stronger. So there will be hyperextension. What is this known as? Come on guys, come on. This is opisthotonus. Opisthotonus. And sometimes there can be sideward bending like this. Sideward bending like this. Like this, like this. This is known as pleurosthotonus. Pleurosthotonus. Sometimes there can be forward bending like this. So this is known as amprosthotonus. Amprosthotonus. So all these are very important. So whenever word tonus, so Rhizus sardonicus, convulsions, lockjaw, pleurosthotonus, opisthotonus, all this you can write in the exam. Hope you are enjoying this, right? So Venkatesh and others, I hope you are enjoying class. Great, that is good. Chal. Next important topic. So very commonly asked, guys, this is very, very important. So what is this? This is very costly plant. Very, very costly. 1 kg of this plant around 2 crore. Okay. So 1 kg is equal to 2 crore. Very costly. Now what is this plant? 1 kg of the product of this plant can give you 2 crore. So you can mint money. So we can settle in our life now. What is this plant now? Can anyone tell me? Jaldi batao. Why? See, if you cultivate this, so 1 kg, 2 kg, you will get a lot of money. So you can cultivate, no? Why not? Can anyone tell me under which act it is punishable? Come on, guys. Yes, so this is basically illegal under NDPS Act. Excellent answer. So this is basically Papaver somniferum. The Papaver somniferum. Papaver somniferum. So in simple word, this is known as opium plant. Cultivation of this plant, consumption of this plant, morphine, punishable under NDPS Act. So 1985 NDPS Act. So the punishment can be 10 years of imprisonment, 20 years of imprisonment, sometimes life imprisonment, sometimes death sentence also. Okay, death sentence is also mentioned in NDPS Act. Good. So what we can see here, white color compound. Can anyone tell me what is this white thing that is there over the seeds? What is this basically? Can anyone tell me? Come on, guys. What is this white thing which is there over the plant? What is that? Glue. Glue होगा? नहीं, glue नहीं है. ये क्या है? Latex है. Very good. मैंने कहा सेलिंग सर latex होगा. Yes, latex मतलब क्या है? Gum है. Okay. So this is basically gum, latex, whatever. So this is latex. This is nothing but morphine. Morphine, which is a natural alkaloid. So it acts on gamma, kappa, delta receptor. So it acts on what? Gamma, kappa, delta receptor. Delta receptor. So when this drug is taken, so this lead to euphoria. Euphoria. What do you mean by euphoria? What do you mean by euphoria, guys? Euphoria मतलब मैंने कहा Srinivas. Euphoria means what? Euphoria. हाँ, very good. Sanskar is telling sir extreme happiness, है ना? Extreme happiness, like dancing with Rambe Urvashi, flying somewhere in other planet. So that is something like that. So euphoria means elevated mood. Elevated mood. So he will get lot of energy. So when he gets lot of energy, it can lead to road traffic accident. है ना? Road traffic accident. It also increases your confidence. So it can lead to rape sometime. Or when doctor is taking this drug, it can lead to death of the patient. That can be infamous conduct. Infamous conduct. You must be knowing one very famous movie in Hindi, Kabir Singh movie, है ना? Kabir Singh, Arjun Reddy movie. In that movie, doctor is actually addicted to heroin and alcohol, है ना? So all this basically. So it leads to euphoria. Dancing with Rambe Urvashi, I said, that's okay. So fine. And also sometimes it leads to erotic hallucinations. Some pleasurable hallucination. So talking to God or talking to someone who is already dead, maybe lover or maybe Deepika Padukone, like whatever, like. So that is basically euphoria. Then iske baad hoga. Then there will be meiosis. Pinpoint pupil. Very, very important question, guys. Pinpoint pupil. Then comes his respiratory depression. Respiratory depression. So whenever question asks, triad of opium poison, euphoria, respiratory depression, meiotic pupil, then other condition. So there can be constipation also. Constipation, coma also. So sometime when overdosage can lead to coma, respiratory depression, and death of the patient. Okay, so this is what important, guys. Okay. Now my question is, all of you, now inside this fruit we have poppy seeds. Poppy seeds. My question, poppy seeds, poisonous, non-poisonous? Can anyone tell me? Manica and others. इसके अंदर पॉपी सीड्स होता है ना, ये पॉइजनस है और नॉन पॉइजनस है? कौन बताएगा? जल्दी बताओ, जल्दी बताओ, टाइम नहीं, ज्यादा टाइम नहीं है. गुड गुड. So come on guys, I'm waiting. Non-poisonous, very good. Poppy seeds are in general non-poisonous. So we use this in sweets, laddus, sweets, and also in some milk preparations. You know, we call it as kaskas, kaskas in common language. So they are not poisonous. They can lead to some sedation, but they are not actually poisonous. Poppy seeds are non-poisonous. So this can be a question. This can be a spotter as well. Now comes is the treatment. So treatment. So now we'll write here treatment. So treatment again depending upon the signs and symptoms, depending upon the history. So, but any case of this drug overdosage, you must inform police. You must inform police. Then you can do all the treatment. So basically treatment is naloxone. So what is the treatment? Naloxone, which is the antagonist. Long acting naltrexone. Naltrexone. In case of addiction, methadone. Methadone. Okay, this is about treatment. Now comes his MLI. MLI. What is your doubt? Okay. Uttar Pradesh. Okay. Now comes his MLI. कौन बताएगा MLI? What is MLI? Let's see. MLI क्या होती है? Medico legal importance. So we are forensic expert. We are worried about only the MLI. Okay. MLI. जल्दी बताओ. हाँ, one is medical negligence. ठीक है, very good. Medical negligence. So this morphine is given in cancer pain. The overdosage of morphine can lead to death of the person. So medical negligence. So taking this drug and treating also medical negligence. Good. और क्या होता है? Mechanism beta, it acts on the gamma receptor, suprareceptor and delta receptors. It causes euphoria and dysphoria, constipation, meiotic pupil and all. So that you can learn in pharmacology. So forensic, this is fine. So medical negligence, okay. Then anything else? Insanity होगा. अच्छा, drug abuse, very good. Drug abuse. Drug abuse. So it leads to physical dependence. It can lead to psychological dependence. So it is used in kidnapping. Kidnapping, especially women trafficking, child trafficking. Because of the physical dependence, it causes very high physical dependence. Very bad. So morphine, it causes very high dependence. It's a very bad drug. So this morphine, no boundaries, no father, no mother, no sister, no lover, nothing. Only morphine. So for morphine, he can do anything. He can do murder. He can do any illegal work. So that's why it's a very bad drug, I say, especially opium, heroin and all. Then also it is also used in infanticide. Infanticide. It's an ideal infanticidal drug. Okay. So all these are important. Also aphrodisia, good. Sanjana Lakesh is telling. Body packer syndrome. One more point is body packer syndrome. So body packer syndrome. So that lead to sudden death in some individual. So those who transport high amount of heroin, morphine from one country to other country by consuming morphine packets. So that can get open and lead to sudden death due to respiratory depression and death. So in my experience, 1 or 2 cases of body packer syndrome. So the sudden death in airport, sudden death in flight. So one differential diagnosis. So probably a body packer syndrome. Good. Doping of horse, okay. mules, that's okay. Sometimes it is taken as a aphrodisiac along with the cocaine. So all these are important points. I hope you understood this. So this is you need to write in the exam. I'll repeat again. So opium poison, the plant name is Papaver somniferum. The cultivation of this plant is highly illegal as per NDPS Act 1985. So what you can see here, the plant and the latex is nothing but the morphine. So in Uttar Pradesh, Gajipur, there is a legal cultivation of this plant. So morphine is also used in cancer pain. So and I said about the mechanism, it acts on the gamma kappa delta receptor. It leads to euphoria, meiosis, rapid depression, coma, and treatment is investigation, basically Markov test, then naloxone, naltrexone, and methadone that is given. And medical legal importance, I said, the medical negligence, drug abuse, kidnapping, infanticide, and body packer syndrome. I hope this is clear. Come on, guys, is it clear? Clear, not clear? Say, just write clear, not clear in the chat box, so that we will start next topic. Manak and others. Srinivas, so it can be heroin also. A body packer syndrome, not only cocaine, it can be heroin also. Any drug. Because these drugs are very costly. So 1 kg of heroin can be around 1 crore, 2 crore. So that's why. That's great, Srinivas. Okay, clear. That's great. Chalo. Now, next topic. Next topic, very important 3 marks question. What are the poisons leading to meiosis? Meiosis, very commonly asked. So you need to write about 3 important agents. So one is opium, OP poison, barbiturate, chloral hydrate. Chlorohydrate, phenol. Phenol. Okay. Three marks question and Viva question. Good. Then look at the image. Midriasis. So midriasis caused by 3. One is Datura. Second, cocaine. Then atropine. Atropine. Scopolamine. Any other? Smaranyahati. It is basically the substance increases sexual desire. Okay. So the next important question. So guys, so this is very, very important. Preparations of ethyl alcohol and the stages of alcohol intoxication and medico-legal importance. Very, very important. So, okay guys, so come on guys. Now look at this. Now can anyone tell me what is the drunkenness certificate should be given in this patient? So this patient is having nystagmus. This patient is having incoordination. So he's doing like this, incoordination. Okay. So my question is he under the influence of alcohol or not under the influence of alcohol? So can be asked in your exam. Yes, guys. Good. So he's under the influence of alcohol. So a very important topic is ethyl alcohol. Ethyl alcohol. Okay. So point number 1, is it CNS depressant or CNS stimulant? मतलब CNS depressant है or depression or it is stimulation? My question is very simple question. Yes, good. So it's basically CNS depressant. CNS depressant. So it causes sleep, very nice sleep when overdosage, or it can lead to coma. But in the beginning, in low dose, it can cause stimulation. So when 30 ml, 60 ml is taken, so there can be stimulation can occur. So my question, which is dangerous, stimulation or depression? Which is dangerous in general in forensic medicine? Either stimulation or depression? Come on guys, if so, why? Now let's make it interactive, guys. Which is dangerous? Very good. Smaranda is telling, sir, stimulation is dangerous. Why? Because so it can lead to road traffic accident. A normal person, he will apply brake at 200 meters. Say example, suppose 200 meter. But alcoholic person, because stimulation is there, it increases confidence. So he will apply a brake at 100 meter. He looks so confident. So it can be associated with road traffic accident. Sometimes it can be no inhibition. It is associated with rape, sexual assault, especially gang rape. Alcohol is one of the agent that is consumed by the culprits because no inhibition. Sometimes it is also associated with negligence, especially doctors, Arjun Reddy, Kabir Singh. It can be infamous conduct. Okay, and in this apparent stimulation, so the person can be over talkative. So over talkative. And the question comes in the exam is, what is the legal limit of alcohol for drink and drive? Legal limit of alcohol. Come on guys. What is the legal limit of alcohol? 30, 60, 90, 100, 180. So very good. So it is basically 30 milligram percentage. 30 milligram percentage. So this is point number 1. So this we can write. So ethyl alcohol is good, okay, but methyl alcohol is very bad. So it leads to so many complications like blindness. It can lead to pontine hemorrhage. It can lead to death of the person. So that is known as wood alcohol. So all these are important points. Now preparation. So look at the question here. Asked in one of the university exam. Preparations of ethyl alcohol. What are preparations of ethyl alcohol? Okay. So Smaranda, you can ask me at the end. Now look at this. There are some preparations are there. So all is the preparations. So it can be beer, light beer, strong beer, whiskey, vodka, rum, and all. You can see here. So can anyone tell me what are different preparations? Wine bhi hoga, sherry. So this is basically beer. So beer around 6 to 8 percentage. Champagne around 10 percentage. Sherry is around 15 percentage. And so this can be whiskey. So whiskey, rum, and vodka. So around 40 to 50 percentage. So which is known as hard drink. So it's known as hard. So beer is normally known as soft drink. So it is light drink we can call it as, but this is hard drink. Okay, yeah. Come on, good. You can write about few points. Then comes is, what are the stages of alcohol intoxication? The first one is stage of excitement. Stage of excitement, stage of stimulation. Okay, so at what level? 50 to 150 milligram percentage. 50 to 150. So in that stage, he will disclose the secrets. So you might have seen in movies and all. So when then they will take 1 or 2 drink, suddenly they'll become very conscious. They will disclose their secrets, past secrets. I have seen many guys. They disclose their secrets of old girlfriend, boyfriend, and old habits and all. So and also well-being. So they look very confident. Like this, they will do very confident. 50 to 150. Then stage of incoordination. So that is 150 to 250. More than 250. So that is stage of coma. So there are basically 3 stages are there. So my question, guys, what are the tests to confirm incoordination? What are the tests to confirm incoordination? Good. Come on, try. So incoordination is confirmed by, one is Romberg test. एक होगा Romberg test. So you must be knowing it is normally done in cerebellar disease. Okay, Romberg test. Then also straight line walking test. Straight line walking test. So ask the patient to walk on the straight line. So like this, walk on the straight line. Then also ask the patient, to finger nose test. Finger nose test. Finger test. Okay, finger nose test. Finger test, Romberg test. All these tests we can do. Okay, yes, come on guys, good. And also we can ask nystagmus also. You can also check for nystagmus. And then stage of coma. This is also very important. How to confirm alcoholic coma from other causes of coma? Can anyone tell me? Coma can be caused by opium. Coma can be caused by many conditions. My question is, what is the specific test for alcoholic coma? Let's see who is going to answer. Come on, guys. Yes, Srinivas, very good. Messivan sign, excellent answer. Messivan or McEwan sign. McEwan sign, very good. So very interesting. McEwan sign positive only in the alcoholic coma, not in the other conditions. Okay. So what happens in McEwan sign? So say example our pinky is here. So our pinky, say example. So pinky under the influence of alcohol, and she is in alcoholic coma now. So what you can do? You can slap like this. You can slap like this. Like this you can slap, or you can pinch also. You can pinch the skin. So what happens? Normally pupil is constricted in alcoholic person. When you pinch, when you give painful stimulus, there can be dilation. There can be dilation and slowly returns to normal. So this is positive McEwan sign. Positive in alcoholic coma, not in the other conditions. Okay. Good. Srinivas is answering, all answering. So I hope you understood. In alcoholic coma, give painful stimulus or pinch skin. There will be dilation of the pupil. I hope you understood. Say hi to our Pinky. So Pinky is back today. Say hi guys, Menaka and others, my regular student Srinivas, Sanjana, Lokesh. Just say hi to our Pinky. So she will be happy. She will come again and again in your class, and she will definitely motivate you, and she will definitely make the class enjoyable. Hi Pinky. Yes, Maranya, Menaka, Srinivas. Good. That's great. बहुत दिन बाद, या बहुत दिन बाद, ठीक है, ओके, ये हो गया नाउ पिंकी का स्टोरी. चलो, so this is about stage of coma and all you've understood. Now comes is what is the fatal dosage? Fatal dosage is 150 to 250 ml. So when person is taking 250 ml of absolute alcohol, there are chances of death, but it is very rare, very rare. But fatal period 12 to 24 hours. So what is the cause of death? Aspiration, respiratory depression. So this is about the ethyl alcohol. Now comes is what are the tests for ethyl alcohol? So what are the tests for ethyl alcohol? So again commonly asked in the exam. Test. So there are three commonly asked tests. Okay. Can anyone tell me what are the tests? Kozalka test. Kozalka test. Then breath analyzer. Breath analyzer. C for cavite test. C for chromatography. I'll repeat again. So, matlab, how to detect alcohol in the body? There are different tests. One is Kozalka test, a breath analyzer which works on the principle of Henry. Cavite test and chromatography, gas chromatography. The mnemonic is KBC. कौन बनेगा करोड़पति? आप सब लिखो KBC. कौन बनेगा करोड़पति? crorepati. That is the mnemonic. Keep writing this. Very interesting. कौन बनेगा करोड़पति? KBC. ठीक है. So this is about the alcohol, and treatment of alcoholism basically symptomatic. So drug of anti-abuse basically known as disulfiram. So treatment you can write disulfiram. Disulfiram. Then what are the complications? So what are the complications of taking alcohol? That is also can be asked. So can anyone tell me what are the complications? So क्या हो सकता है? So those who are taking alcohol every day, for example me taking alcohol every day, beer every day, so what happens? So one more point here. So legal limit of alcohol 30 mg%, and healthy limit for male it is 2 units per day, females 1 unit per day. So healthy limits in male 2 units per day, females 1 unit per day. So 1 unit means around 30 ml of whiskey, 30 ml of vodka. So in males 60 ml every day, okay. Anything more than 60, it is definitely bad. It can lead to so many problems. So healthy limit, that is asked in your viva once. So yes, good. Common complications are, one, it can lead to delirium tremens. Delirium tremens. So in delirium tremens, there can be confused state. So there can be confusion, there can be tremors, there can be hallucinations. So there can be delusions, and there can be suicidal tendencies. The mortality up to 30%. So delirium tremens, alcohol withdrawal syndrome. Then there can be Wernicke encephalopathy. So Wernicke syndrome, characterized by global confusion, ophthalmoplegia, and ataxia. Sometimes there can be Korsakoff psychosis. Korsakoff psychosis characterized by dementia, approximate answers. All is because of thiamine deficiency. So there can be alcoholic hallucinosis. So alcoholic hallucinosis. Or there can be degeneration of the corpus callosum. So that is known as Marchia-Fava-Bignomi syndrome. Marchia-Fava-Bignomi syndrome. So all these are commonly asked in the exam. Good. Good answer. Good, good. Korsakoff syndrome. Srinivas. That's great. Congratulations. That's fine. Good. Sandwich. Sandwich appearance. Great, great. So this is okay. Alcohol. Fine. Now I have a question for you guys. Say example, this person is taking alcohol every day and he is under the influence of psychosis. So he is under the influence of delirium tremens. Okay. He is under the influence of delirium tremens because of chronic usage of alcohol. Now he is not normal. He normal nahi hai. So he has some psychiatric issues. Now he will do some crime. Now he will do some crime. My question is it punishable, not punishable? So he will do certain crime, or can be assault, or can be some other offense. Is it punishable, not punishable? Yes, so this is not punishable. Not punishable. So as per 22 BNS. So as per 22 BNS. Commonly asked in the exam. So there are so many things to discuss, but we'll stop here. Preparations of ethyl alcohol, I said many preparations. Then stages of alcohol we discussed. The medical legal importance also I said. So you can write about 22 BNS, road traffic accident, legal limit of alcohol, and the test for alcohol. So if you mention all this, you will definitely get 4 out of 5. So don't worry about that. Okay. So is it clear, guys? Say yes or no? Smaranya and others. Srinivas, समझ में आ रहा है ना? ठीक है. So this is commonly asked. So कभी-कभी पूछा गया है. So many times they asked this. Viva, INI-CET, NEET PG, theory exam, prof exam and all. So good. So delirium tremens basically depending upon the clinical features. Now look at this. Look at this, you tell me what is the finding here in this person. So he's actually a chronic alcoholic. He's under the influence of alcohol. A Romberg test is positive. Nystagmus is positive. Then Strychnine test is positive. Then also finger nose test, finger test, everything positive. My question is, what is the probable alcohol level in this person? He is talkative, over talkative. He is very confident. So and also he jumped from one topic to other topic, and also he has a tendency to assault doctors and hospital staff. So what is the probable level of alcohol in his body? So probably it is more than, so usually more than 80 milligram percentage. Okay, 80 milligram percentage. So whenever you see nystagmus, so it is definitely more than 80. So can it be 100 also? So but usually more than 80, and it is legally punishable. So he can be arrested immediately. So he can be sent into jail. So and also cancellation of the driving license. So yes, fine. Okay. So this is about the alcohol. So now we are going to discuss about forensic spotters. Yes, are you there, guys? So ready for the forensic spotters? Come on, guys. Spotters X-ray. So today's topic is a bit difficult. Widmark formula you can write. So by your own. So also you need to write about Widmark formula. So Widmark formula, that is A is equal to CPR. CPR. So you can just go through this after the class. Okay? Yes. Yes, guys. Shall we start, spotters? Good. So now very interesting question. So he is basically a boyfriend and girlfriend. So both are in deep love. So both are studying in some school or some college. So both were found in some place, some abnormal place, and the father of the girl, he complained in nearby police station. So that is allegation of rape, that is against the boyfriend. So the question here is whether she is more than 18 years or less than 18 years. So as I said many times in the class, in this particular scenario, when it is more than 18 years, so it can be just a love story. When age less than 18 years, is it love story or crime story? Yes, guys. My question is very simple. Girlfriend and boyfriend, both were found in some abnormal space. They were both are found by the police people, and more than 18 year love story and less than 18 year, तो क्या हो सकता है? So less than 18 year, that is basically crime story. Why crime story? Can anyone tell me? Why is it crime story less than 18 year? Come on, guys, come on. Acha, so Smarana is telling, very good, Maneka Datta. Very good, excellent answer. So because it is statutory rape. Statutory rape. Okay, now see, okay. Now, who has to determine the age? Forensic expert. So now X-ray is taken. X-ray is taken. Now this is the X-ray. X-ray of the girl. Basically, this is AP and PA view of elbow joint. Elbow joint. आप देख के बताओ, what is the age of the girl? Now look at this. Age क्या हो सकता है इसमें? ये देखो. Come on, try, guys. This is very important. Very, very important. I'll give some time. Look at the X-ray. Elbow joint. So what you can see here is the humerus, radius and ulna, right? So this is humerus. So this is ulna and this is radius. Radius. Okay. And this is ulna, no? So this must be medial epicondyle. So this is medial epicondyle. So this is radius. So this is lateral epicondyle. And this is capitulum. capitulum, and this is upper end of radius. Upper end of radius. This is upper end of ulna. Now you try. Try, guys. Less than 12 years. Okay. Okay, good. So many they're answering correctly. So for this, you must know when it is going to appear. Okay. Now look at this, go through this, then you can answer. So the capitulum appears at 1 year. So remember, capitulum, capitate. So first to appear, 1 year. Capitate, 2 months. Capitulum, 1 year. So fusion. So fusion, it forms conjoined epiphysis. So along with the lateral epicondyle and along with the trochlea. So no question of fusion. So medial epicondyle, 6 to 7 year. Fusion occurs 14 to 16 year. Trochlea 9 to 11 year. Lateral epicondyle 11 year. Conjoined epiphysis. Conjoined epiphysis formed by lateral epicondyle, trochlea and capitulum. So this is very, very important. 14 to 16 year. And it fuses at around 16 to 17 year. Upper end of radius 5 year. Fusion around 17 year. Upper end of ulna 9 year. Fusion 16 to 17 year. So this you need to memorize. Come on, guys, you just memorize. Then you can tell about the answer. Okay. So in that X-ray, capitulum appeared. That means more than 1 year. Lateral epicondyle, medial epicondyle, trochlea appeared. Lateral epicondyle appeared. So lateral epicondyle appeared. That means more than 11 years. Conjoint epiphysis also appeared. So more than 14 years. Upper end of radius appeared more than 5 years. Upper end of ulna also appeared, that is more than 7 years, but not fused. So now go back to this now. Go back to this and try to answer. Look at this now. See, lateral epicondyle is appeared, but not fused. Medial epicondyle also appeared, but not fused. Upper end of radius also appeared, not fused. Ulna also appeared, not fused. Now you just calculate. Calculate. So what you can see here, conjoined epiphysis. So this is conjoined epiphysis. And what we can see here, dotted line. So this is not fused. So conjoined epiphysis is not fused, but appeared. Now tell me, what is the age? What is the age from this? Yes, very good. Many answers. Srinivas answered correctly. Sir, it is more than 14 years. Less than. So when conjoined epiphysis forms, you can see here conjoined epiphysis is basically 17 years. You should take upper limit, 17 years. Okay. So less than 17 years. So less than 17 years. Yes. I've understood now. Any doubt in this? Yes, Sanjana, Lokesh, great. Srinivas, great. 14 to 16 year. Okay, if you know this, more than sufficient. No need to worry about all this X-ray. This is basically PG topic. So UG, if you know, that is fine. Otherwise, it's okay. Yes, Srinivas, Smaranya, where are you? Smaranya. Okay, now I have one more question for you. Now, for example, both are married. So both are married. Both are married. So boy age is around, boyfriend age is 22 and girlfriend age here is more than 14 and less than 18. Now you tell me, now what are the legal consequences here? What are legal consequences? A very interesting scenario. As you know, legal age in males 21 year. So legal age in girl, that is basically 18 year. So marriage is invalid. So marriage itself invalid. Okay? So marital rape. So this can be, boy can be arrested. Okay. Okay. POXO, yes, it will attract POXO. POXO Act. It will also attract Child Marriage Act. Child marriage. And it also attract 64 BNS. Okay. So kidnapping ये हो सकता है ना, kidnapping. So this is basically 64, right? Good. So this is how you can memorize about the elbow. Okay. So now look at this X-ray and tell me what is the age. What is the age in this case? What is the age here? So good, Srinivas, correct. So it is basically more than 16 years. So we cannot comment on 18 years. So to confirm 18 year, you should look wrist X-ray. Okay. So this is basically more than 16 year. Okay. Now look at this and tell me age. So what is the age here? Second question. This X-ray. Look at this. There is no radius and ulna. So ulna upper end is not there. Ulna is not there. Radius is not there. There is no medial epicondyle, lateral epicondyle. We have only capitulum. Only we have capitulum. So capitulum is there. This is just a 1 year, right? So 1 year. And you can go through this table. See, capitulum appears at 1 year. Only capitulum is there. So upper end of radius is not there. So the next is upper end of radius. So more than 1 year, less than 5 years. So the answer is, so more than 1 year, less than 5 years. Good. Good. So Smaranya here, if you see here, the highest range here is 16 years. You can see 16 here, 14, 16, and here is 16, 17. So maximum is 16. So when all appeared, it should be more than 16. It can't be more than 17. It should be more than 16. It can be 17 also, 18 also. But that should be confirmed with other X-ray. Good. So good, many answered. That's great. Now this is X-ray of pelvis. X-ray of pelvis. Now look at this and try to answer. So this is head of the femur. Okay. So there is no greater trochanter, lesser trochanter and all. There is no ischiopubic ramus. So ischiopubic ramus is also not there. Not there. So there is no acetabulum also. Triradiate cartilage. So no triradiate cartilage. No iliac crest. Not appeared. Iliac crest is also not appeared. So what is the age? So now X-ray. So to understand this, you must know when it is going to appear. So this is 7 centers. So there are more than 7 centers, but if you know 7, more than sufficient. So look at this. Head of femur, 1 year. It fuses with the shaft, 17 to 18 year. Greater trochanter, 4 year. 17 to 18 year. Fusion. This is fusion. Lesser trochanter, 12 to 14 years. 17, 18 year. Ischiopubic ramus formed by 6 year. Triradiate cartilage, 13 to 15 years. Iliac crest appears at 14 year. Fuses at 20 to 21 year. Ischial tuberosity, 16 year. Fuses at 20 to 21 year. So this you need to memorize. So then only you can able to answer. Okay. Just copy this. Just copy this, Maranya and others, Venkatesh, Bhadra and all, Meneka Datta. Just copy this. Just try to memorize this. Then you can try X-ray. So I remember like this 1, 4, 14. Right? So example, this is head of the femur. Okay. Head of the femur. I remember 1, 4, 14. 1, 4, 14. So this is femur. So all of you write in the chat box. 1, 4, 14. Keep writing. 1, 4, 14. लिखो. 1 मतलब head. Head मतलब only one head, 1 year. Greater trochanter, 4 years. The lesser trochanter, 12 to 14 years. 1, 4, 14. Guys, okay, keep writing. Keep writing like this. 1, 4, 14. Hai na? Guys, good. Same way in shoulder joint. Shoulder joint, same way, shoulder joint. 1, 3, 5. You know, in shoulder joint also we have greater tubercle, lesser tubercle. 1, 3, 5. 1 year head, greater tubercle 3 year, lesser tubercle 5 year. So 1, 3, 5 year. Good, shoulder joint. That's great. Good boys. You are all good boys, great boys. So great. Now, okay, this is clear. Now you just go through this and try to answer. Now देख के बताओ, what is the age of this X-ray? Now see, only one thing visible here, head. Only head is visible. Nothing else is visible. Only head visible. Nothing else is there. Okay. What is the age? Then greater trochanter is not there. Okay. So head is there. Head is plus. So more than 1 year. Greater trochanter, GT. GT is not there. So less than 4 year. So the answer is 1 to 4 year. 1 to 4 year. Is it okay? Great. Now, let's see now. Let's see this. Now look at this now. Look at this X-ray. Okay. Again, it needs some skill actually. Some skill is needed. So what you can see here. So head is there here. So head is there, but not fused. Not fused. GT is there, but not fused. Ischiopubic ramus is there. Ischiopubic ramus is there, appeared. But lesser trochanter is not there. Lesser trochanter is not there. Okay. Lesser trochanter, LT not appeared. NA not appeared. Now you tell me, what is the answer? I said lesser trochanter 12 to 14 years. And look at the triradiate cartilage. So triradiate cartilage almost appeared, but not exactly. You can see the gap here. So there is not appeared. Okay, na? Not appeared. So now tell me what is the age here. So the age here is 4 years. But ischiopubic ramus, when ischiopubic ramus appears, look at this. Look at this, ischiopubic ramus. Where is ischiopubic ramus? 6 years. 6 year is there. So it's more than 6 year and less than 14 year. Right? So it's more than 6 year. Less than 14 year. Imagine one condition. Now he is working in a hotel. Okay. A supplier था, है ना, X-ray victim ना, he was supplier in a hotel. Supplier in a hotel. So my question is, what is the legal consequence of this medical legal age? Legal consequence. Good. So it comes under Factory Act. Okay. So Factory Act. So Factory Act states that any child of less than 14 years should not work in any setup, hotel, cinema theater, mall, any setup. Up to 14 years, it is compulsory education. No work, nothing. So, who is punishable? The owner of the hotel. So, owner of the hotel. Jail. क्या होगा? Jail होगा. Jail. So, he will go to jail for sure. है ना? Good. Okay. Factory Act. Okay. That's okay. Factory Act. So now look at this X-ray. Now this X-ray. Look at this and try to answer. So this is the X-ray of female. So female. Same story. Same story is there with you. And is it a crime story or love story? ये क्या हो सकता है? लव स्टोरी हो सकता है और क्राइम स्टोरी हो सकता है. क्या है? देख के बताओ. Now look at this. Iliac crest is appeared and fused. Iliac crest is appeared and fused. I'll just write head of the femur appeared and fused. Lesser trochanter, greater trochanter appeared and fused. Lesser trochanter also appeared and fused. Ischial tuberosity appeared and fused. Ischiopubic ramus is there. Triradiate cartilage is also there. Now my question is, love story or crime story? So just write love story or crime story. Very good. So Manjunatha Datta said, sir, A hoga more than, but ischial tuberosity is appeared. You can see here ischial tuberosity is appeared. So what you can see here, ischial tuberosity. Now look at this. Ischial tuberosity appears at 16 year, fuses at 20 to 21 year. Here appeared and fused. So it's appeared and fused. So what is the age? So age more than 20 years. So she is more than 20 years. So she can give consent for sexual intercourse. She can give consent for organ donation. She can get driving license. She can she also can marry, and also she can join. She can undergo major surgery. She can give her kidney organ transplantation. So more than 18 year major. She is not juvenile. She is definitely major. So more than 18 year male or female. So major. Okay. Less than 18 year juvenile. Good. So can she marry, guys? Can she marry? Can she marry? My question is, can she marry? Okay. Good. So yes. Yes, she can marry. Now same male. Can he marry? Male hai, theek hai? Male. Age is more than 20, but we don't know more than 21. It's 20 only. Can he marry? Can he marry now? Now she become he. Can he marry? No, 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 SJ. No. He can't marry. So marriage age is 21 year in India. This is how you can answer. Okay. Now wrist X-ray. Same question. Crime story or love story? So here radius appeared and fused. So radius is fused. Allah is fused. Physiform is appeared. Appeared. So you can see the physiform. This is physiform. So this is radius. And this is ulna. Ulna. So this is first metacarpal. Appeared and fused. So what is the answer? So it is more than 18 years. So more than 18 years. So good. So the first to answer by Srinivas. Good. So Divya Raj. Okay, more than 18 years. Okay. So now last few questions, guys. So last few minutes. So we started today at 7 o'clock. Now already it is 9:30, 9:15. So great. Last few minutes, 5 minutes only. Now look at these seeds in toxicology. So these are shiny seeds and very poisonous seeds. When it enters the blood, causes anaphylaxis, hemorrhages, and death. So fatal dosage 10 seeds. So 5 points about this. Any 5 points. Try, come on, guys. Come on. So only 20-second time. In 20-second time, you need to answer. So come on, guys. 1, 2, 3. So come on, try it. Okay, good. SJ is first to answer. SJ, very good. SJ, good answer, SJ. So SJ said, sir, castor seed. तो कैस्टर में होता है रिसिन. Fatal dosage 10 seeds. So it is organic irritant and umbrella murder case. Umbrella murder case. Seeds are shiny. Okay. Good. SJ is first to answer. Fine. So that's great. So next question. Next question. Look at this now. So 5 points. Okay, 5 points. 5 points about this condition. It take a one time, 20-second time. So now I am in shower pariksha room. So there is a froth around the mouth and nostril. So there are some petechial hemorrhages. So my question: what is the cause of death? What is this case? Then what is the fatal period? What are the signs of ante-mortem drowning? So 5 points you can just mention. So as I said, so this is case of drowning. So cause of death is asphyxia. So cause of death is asphyxia. Then there is a froth. So fine leathery froth. The fatal period is around 5 to 6 minutes. So cadaveric spasm is a feature of ante-mortem drowning and diatoms. Diatoms. So good answer. So this is basically answer given by okay, Manjunatha Datta, Srinivas. Very good, Srinivas. Srinivas, excellent answer. Good. And some student answering PS railway drowning, good. And also from Divya answering poisoning. Yes, it can be poisoning also. So it can be OP poisoning. It can be opium poison. It can be snake bite also. Snake bite also. Good. Snake poison also. That's great. Now, the question number 9. The question number 9 is very interesting. What is this image suggestive of? In forensic medicine, what is this image suggestive of? Come on, tell me. Good. Manaka and others, try. So any 2 or 3 points about this. So 1, 2, 3, 4 points. In forensic medicine, very good. Manjunatha Datta, excellent answer. So Datta, very good. So she said or he said, sir, buttock up. Buttock up. Buttock up. Hai na? Head down position. So this is known as head down position. Head down. So what you can see here, buttock up, head down. Can you see that? So this is classical position of dead body in case of drowning. So this is a case of drowning in the water. So drowning in water, dead body. So this is a position acquired by the dead body after some time, maybe after 1 hour, 2 hours, when all the air that goes out from the dead body, it goes to bottom of the river. Hai na? Goes to bottom of the river. In the bottom of the river, it will be something like this. Something like this. Good. Okay, Manjunatha Datta. Okay, Manjunatha Datta. Okay, good. Srinivas. So that's great, Srinivas. Okay. Now fine. Now where is the post-mortem hypostasis? So where is the hypostasis? So hypostasis usually over chest, neck, and front of the leg and the arm. So dead body something like this, है ना? Something like this. This is asked in INI-CET exam. Good. Now one more point is there. After how many hours? So the body will come up to the top of the water. When dead body will float. Normally after drowning, dead body will sink. After how many hours it does come to top of the water? How many hours? So it's around 24 hours. So after 24 hours or maximum 48 hours. If it is cold season, maybe 48 hours or 72 hours. But in general, summer, so there will be formation of decomposition, gas and all. When gas is formed inside the abdomen, so especially the intestine, so body will float because specific gravity decreases. So it is because of decomposition. So this is what the important points about this. So I think this answer given by our favorite student Manjunatha, very good. So Divyaraj, good, great. Chal. And the last question for you. Before that, I think yesterday some student asked me, sir, what is drowning index? So drowning index is equal to, so weight of both the lungs plus pleural effusion divided by weight of the spleen. When it is more than 14.1, then it is drowning. Less than that, it is non-drowning. Again, this is not very good index. So just given in standard textbook, drowning index is equal to weight of both the lungs plus pleural effusion divided by weight of the spleen. More than 14.1, drowning. Less than 4.11, non-drowning. Okay, Dr. NK, beta, Dr. NK Name Khan. So great. Thank you, Name Khan, NK here. That's great. Great to see some students here. Chalo. Now the last question for you. Now this is very important question from forensic medicine. What is this basically? Come on, try guys. Let's try. What is this in forensic medicine? Now I am in the autopsy room. So as if I don't know anything, I'm in the autopsy room. This is stomach. The stomach showing dot line. I don't know what it is. Can you help me? Flea bitten? No. They better. Manjunatha, this is stomach, I said. So this is stomach. This is not liver. Stomach. I'm not giving you clue. Why stomach? Because rugae are there. You can see the rugae here. When you see rugae, then it is stomach. Okay, phenol, nine. So in phenol poisoning, there will be hardening of the stomach. We call it a leathery stomach. That is not the answer. बताओ दिव्या स्टमक ओके चारिंग भी नहीं है नहीं चारिंग कहाँ है ये नॉर्मल लुकिंग स्टमक है देखो नॉर्मल स्टमक आपको नॉर्मल दिख रहा देखो ये सब नो ब्लैक नथिंग नॉर्मल लुकिंग स्टमक everything normal you can see here but there are dot lines are there like tiger dots are there tiger dots है ना tiger dots. What is this? No. Smaranya Hati in H2SO4 you will see perforation. Okay. So in H2SO4 you will see black mass. So just a black mass you will see. Okay, black mass. Nothing else. So but it is normal, something normal. H2SO4 nahi hai. फिनॉल भी नहीं है. हाँ, very good. Very good, Srinivas. Excellent answer. Excellent answer. Great, great answer. Great, great, great. Excellent answer. So this is basically known as Vishnu sky spots. So this is seen in case of hypothermia. Hypothermia. Okay. Great answer. Great. So many answered correctly. So that is the answer I wanted. So kerosene bhi nahi hai. So SJ. Very good. So this is how you can answer. So this is what the Farre series. So we started last month around 8 classes, 8 regular classes with lot of images, lot of stories. Okay. So I hope you're enjoying Farre classes. So I hope this is useful and also interesting. So what is important is interesting. So yes, guys. Yes, Divyaraj, there are many classes. You can just go through playlist. You will come to know playlist. So this completes your Farre series. So thank you all. So thanks for your all patience interaction since last 1 month. So Menaka Datta and others. So Srinivas, Divyaraj, okay. So Menak, so we already completed 8 classes. Okay. Now Farre is completed. We completed Farre. So if there are any classes, I'll let you know in upcoming days. So that I will message you in Instagram. Menak Datta, thank you. Great. So okay guys, so with this, so we are going to end Farre 2.0. Wish you all the best for upcoming university exam. So go through all important questions what we discussed in last 8 classes. Just revise so in 2x speed or 3x speed and just memorize. So like in exam, so write definition, types, pathogenesis, clinical features, treatment, medico-legal aspects. So in forensic medicine, write medico-legal aspects. Suicide, homicide, accidental, like that. Okay. So thank you all. Thanks for your interactions.